For example, recent polls show that 48% of Americans support repealing the law. That's versus 47% that would like it kept intact or made stronger. Now what's interesting is that these same people, when asked specifically about provisions like small business tax credits, closing the Medicare donut hole, banning pre-existing condition exclusions, providing subsidies to lower income Americans to help them buy health insurance, when they hear about these, there's over 70% support for all of these provisions. Insurance companies are going to start being held more accountable. They're going to have to spend at least 85 cents on the dollar on patient care and physician reimbursement. They can no longer deny coverage based on pre-existing conditions. They can't drop coverage at will just because somebody gets too sick. And the claims process is going to be streamlined, so our lives are going to be easier and hopefully our overhead will drop. Thank you again for your time and your attention, and I look forward to this discussion.
Now, a lot of people look at Obamacare like a meteor headed towards the profession. They want to run for the hills and scatter and go to the first safe harbor, like ACOs and incentives and EMRs and things like that. But I want to tell you, that's not a meteor, that's a balloon. It's not that big a deal if we choose to stand together. If we are united as physicians, you'll find that we can accomplish anything in medicine. And I believe that we do need to repeal this bill, 95% of it. We need to replace it with real reform. And we also need to resist as physicians, because some of the things we're going to be asked to do will harm our patients and certainly will end our profession as we know it. We can usher in a new golden age of medicine. We can use the DNA code to make people walk again, to cure cancers, to replace organs, things that will be very difficult to do in the scheme that's set up that will tax innovations like medical devices and drugs and will harm the professional development of our profession.